Hello, my name is Katie Monaco, and I am a registered nurse and current nursing student at Indiana State University. This is my health education program for Nursing 444 Community Health Nursing on the vulnerable population of immunocompromised and immunosuppressed individuals. This health education program will present factors contributing to being immunocompromised and having a weakened immune system as they relate to this population's increased risk for adverse illnesses related to infections and infectious diseases, with special features relating these risks associated with being immunocompromised during the current coronavirus pandemic. At the end of this presentation, you will be able to explain what it means to be immunocompromised, identify factors contributing to a suppressed immune system, recognize groups that are at risk for becoming immunocompromised, explain how immunocompromised individuals can protect themselves against communicable infections, discuss the significance of food safety awareness for the immunocompromised population, and lastly, explain the concept of community immunity. Before we begin, please click the link provided below to take the 10-question pretest. So what does it mean to be immunocompromised? This means you have a weakened immune system, and your body is unable to fight off or respond normally to infections or diseases. It can be a result of chronic medical conditions or an autoimmune genetic disorder, which means you have an increased risk for common infections such as cold or flu, as well as uncommon infections caused by various strains of bacteria, viruses, fungi, or parasites. Immunocompromised is also known and referred to as being immunosuppressed. So who is most at risk for becoming immunocompromised? I have listed several populations here, but I've highlighted the most important and the focus for this presentation. So I have patients with HIV and AIDS, cancer patients, those receiving chemotherapy or radiation therapy, transplant patients, older adults who are largely at risk for becoming immunocompromised just because your immune system weakens by nature as you age. Also, patients with moderate to severe asthma, and those who are taking certain medications. This includes anti-cancer medications, steroids, and anti-rejection medications such as tacrolimus or cyclosporine. These are also known as immunosuppressants, which you see in transplant patients, and they make the body less likely to reject a foreign object such as a transplanted organ. So why is the topic of immunodeficiency a community health concern? Well, when a person is immunocompromised, it means there is an abnormal functioning of their body's immune defense system. This makes an immunosuppressed individual highly vulnerable to infection via spread of communicable illnesses and diseases within the community. Currently speaking, in regards to the current pandemic of coronavirus and COVID-19, immunodeficient individuals are severely at risk for contracting the virus and developing complications due to their body's decreased reaction to otherwise obvious signs and symptoms of infections, such as fever and cough. According to the CDC, and based on available information, data, and clinical expertise surrounding COVID-19, adults 65 years of age and older with multiple medical conditions are at the highest risk for contracting severe illnesses related to coronavirus. As I mentioned in previous slides, adults ages 65 years of age and older are also most at risk for becoming immunocompromised as the immune system weakens on its own over time. Additionally, older adults have increased chances of having a weakened immune system because along with age comes a number of health issues and chronic conditions. In fact, 60% of older adults manage at least 2 or more chronic conditions, such as heart disease, cancer, COPD, or diabetes, to name a few. And as we all very well may be familiar with, chronic conditions and health issues are most often managed with a variety of medications. And unfortunately, with medications comes a plethora of side effects. Therefore, management of chronic health conditions, along with the undesirable natural effects associated with the process of aging, we can see how older adults are likely to have a significantly higher risk of having a weakened immune system, therefore making them immunocompromised and most vulnerable to infectious disease and illness. In addition to adults 65 years of age and older, people with moderate to severe asthma are also considered to be immunocompromised, as they are at an increased risk for developing severe illness secondary to infection. Asthma is defined as a chronic condition and is therefore associated with exacerbations caused by inflammation and narrowing of the lungs and airway. The exacerbations are most often occur as a result of a developing or present respiratory infection. Since asthma is a chronic condition, individuals with moderate to severe asthma are at an increased risk of developing a weakened immune system over time, therefore categorizing them as being immunocompromised with high risks of frequent respiratory illness caused by infections. Furthermore, as I touched on in the previous slide with older adults, chronic conditions such as asthma require daily medications for management. Asthma also requires short-term relief and rescue medications, and both maintenance and short-term meds have their unavoidable and undesirable side effects, requiring management of their own. The management of such side effects further weakens the immune system and increases the chances of these individuals becoming immunodeficient. Lastly, over time, people with asthma develop scar tissue in their lungs and airway, which eventually leads to difficulty for airways to open up. This is called airway remodeling. In relation to COVID-19, the formation of this scar tissue places people with moderate to severe asthma at high risk for becoming extremely ill if they contract coronavirus due to its damaging effects that the virus has on the lungs. Another population at an increased risk of becoming immunocompromised is people of the HIV and AIDS community. As evidenced in the name itself, HIV and AIDS is an example of an acquired immunodeficiency, which I talked about at the beginning of this presentation. The HIV virus attacks CD4 cells, also known as T cells, which act in the body's immune system to attack and fight off infectious agents and diseases. Over time, the ongoing destruction of CD4 cells eventually prevents the body from being able to defend itself against infections and other diseases altogether, therefore leading to an increased chance for opportunistic infections and cancers to appear. In terms of COVID-19, the risk for severe illness in people with HIV and AIDS is highest among those with a CD4 count less than 200 and those not on HIV treatment, also known as antiretroviral therapy or ART. It's also highest among people with HIV and AIDS who are older in age with additional comorbidities and chronic medical conditions. Therefore, it is extremely important for people with HIV to maintain a healthy lifestyle in order to best decrease their chances of contracting an infection. People with cancer are another vulnerable group for becoming immunocompromised, as they are at an increased risk for infection due to some of the changes that occur in their body's immune system as a result of the type of cancer itself, as well as many other factors. Some of these other factors include the types of cancer treatments being used, and these types of treatments also vary in the manner in which the immune system is impacted. For example, chemotherapy treatments are targeted to damage the bone marrow, therefore making bone marrow less able to produce enough red blood cells, white blood cells, and platelets within the body, although usually the greatest impact is on the white blood cells. And as we know, when a person doesn't have enough white blood cells in their immune system, they are more vulnerable to infection. Another factor includes poor nutrition, whether this be a result of a decreased appetite related to medications or cancer treatments, or decreased dietary intake, which also contributes to a weakened immune system. This is because cells need nutrients to grow and work, and without adequate intake of essential nutrients, such as vegetables, minerals, calories, and protein, the immune system is too weak to fight and destroy germs. So when the body is poorly nourished, it is more likely for a person to develop infections. And lastly, some other additional health problems that may occur secondary to cancer also play a role in weakening what's left of an already depressed immune system for cancer patients. Examples include skin infections, infected Metaport insertion sites, blood infections, or an acquired resistance to specific antibiotic treatments. Yet, in any case, infection in people with cancer can be a medical emergency. This is important as it relates to our current health issues of COVID-19 within our communities, and it's extremely important for people with either current cancer or a history of cancer to be aware of proper infection prevention strategies, as everyone with cancer is considered high risk for developing severe illness if they contract coronavirus. The last group I chose to focus on for this presentation is people belonging to the solid organ transplant population. This population holds a special place in my heart as I work closely with patients belonging to the kidney transplant community pretty closely. And transplant patients are considered immunocompromised for the duration of their lives following an organ transplant. Unfortunately for them, dealing with infections is one of the largest hurdles to living disease-free once they have an organ transplant. One main factor contributing to transplant patients' weakened immune system is due to the medications required for the duration of their lifetime following their transplant surgery. Transplant recipients spend the remainder of their lives on anti-rejection medications in order to prevent their immune systems from attacking the implanted and transplanted organ. These medications are called immunosuppressants, and they weaken the ability for an otherwise healthy body to fight off infections. This makes the body highly vulnerable to illnesses caused by viruses, bacteria, and fungi. Anti-rejection medications can also cause suppression of an illness or infectious symptoms within the body. So, otherwise obvious signs and symptoms of an infection or illness may appear milder, which can cause patients to delay seeking treatment when an illness or infection first presents itself. Currently speaking, the CDC has identified organ transplant patients as part of the high-risk immunocompromised population for COVID-19. The suppression in symptoms related to an illness or infection can be a serious problem if transplant patients are exposed to the coronavirus. While there is still so much evolving knowledge surrounding COVID-19, the best way to protect transplant patients and prevent severe illness is to avoid exposure to the virus altogether. Again, this reaffirms the importance for all immunosuppressed and immunocompromised individuals to follow the recommendations of the CDC, their local health department, and any additional recommendations provided by their doctors and medical team. People within an immunocompromised population can be protected against illness and infections by prevention efforts made at the community level. Did you know that when you get vaccinated, you are not only protecting yourself against germs and disease transmission, but you are also protecting your community? This concept of double-edged protection is called community immunity, but may also be known or referred to as herd immunity. Germs travel quickly through a community, leading to an increase in the number of people who may become ill at one time. This leads further to a full-blown outbreak of a certain disease. Community immunity protects everyone through vaccinations against a specific disease. The more people receiving vaccinations results in lowered rates of germs and disease transmission. Community immunity is especially important for people who are unable to get vaccinated as a result of an autoimmune disease or those with poor immune systems, such as the immunocompromised patient populations discussed here in this health education program. An example of community immunity success can be seen in the implementation of the pneumococcal vaccine. Now that my presentation is complete, please visit the link below to show me what you've learned by taking the 10-question post-test.